Yeah.
I feel like optimists would be better suited to CBT and pessimists to break it down
That's
further,
that's an interesting way to look at it. I'll have to pay closer
do a
attention.
study on that.
That intervention in and of itself will get people on a different path. But then I go into the psychological treatments, biofeedback, hypnosis, cognitive behavioral therapy, acceptance and commitment therapy, mindfulness-based stress reduction that we talked about before. And then the last area, I said three, this is four actually, is lifestyle factors. People do not realize how much their lifestyle is going to affect their pain.
Welcome back to part two with Dr. David Cosio. Let's dive in. So, our next deep dive section, we're going to be looking at the different types of therapies. So, before we start, can you just tell us a little bit about the difference between acceptance and commitment therapy and cognitive behavioral therapy?
Absolutely. So, cognitive behavioral therapy has been around for decades, and it's really looking at how we can change people's maladaptive thinking and their behaviors to improve their perception of pain or their experience of pain. So, in that treatment, what we're doing is we're finding maladaptive thinking and we're changing them. And the same thing if we're finding maladaptive behaviors and we're changing those. That's very different than acceptance and commitment therapy. Acceptance and commitment therapy is newer. I would say it's probably within the last 2 decades that it's came out, and it's really about becoming aware of those thoughts and those emotions and those memories and those behaviors, but not necessarily asking people to change them. You're making people aware of those things and how they may impact their experience of anxiety or pain, but then addressing the things that are important in their life. We don't have any control. We don't have any actual control of the pain generator,
Mm,
meaning, if you have a bulging disc, there's very little we can do about
yeah.
that, but that is going to affect your entire life.
Mm,
Same thing with anxiety. I think anxiety is a medical condition that may require, medications, but also some coping strategies.
mm,
Um, and part of that is to make the person aware. You can't change something that you're not even aware that you're doing. And
yeah.
so acceptance and commitment therapy is using, things like mindfulness and meditation to kind of bring people in the present moment and becoming more connected with their thoughts and their feelings. And then from those kind of that awareness, they may choose to make a change. But what we're asking them to do is to let go of the things they don't have any control over and really focus on the things that they do that are important to us. So family, friendships, the other things in life other than the disease. Right.
Fantastic. So, would you say one form of therapy is more effective than another, or when are you more likely to recommend one over the other when addressing anxiety and chronic pain?
So we've done research on both and we've done research on different formats, so shorter formats versus longer formats, manualized treatments versus non-manualized treatment. And what we find is they're the same. They're the same. They
Oh,
just they just require different amount of time. So
mm,
when we do cognitive behavioral therapy, what we see is that there's a push and tug, right? Where you're asking the person to make a change and then they try to make the change and maybe it doesn't work and they have to go back. There's like this tug
mm,
and pull that occurs. And you can see that with the data. You can see it
yeah.
kind of doing these like curves because the person's constantly in the state of change. With acceptance and commitment therapy, what we found is after 4 sessions of acceptance and commitment therapy, their distress plummets and stays down. And that's because they're learning to kind of view the world in a different way. And they're not asked to change anything. They're just because of that realization, their distress kind of lowers, right?
Wow.
And so I'm a really big fan of, I mean, you probably tell, I'm a really big fan of acceptance and commitment
Yeah.
therapy because it's new, right? It's the new therapy, it's a new kid in the block. But I've seen that it works a lot faster. Now, your question about who do I refer to what? If I feel like someone has the ability to kind of be aware of their thinking and their emotions and they know what a thought and emotion is, if there's a little bit more intuition or insight, I might push them towards acceptance and commitment therapy because they already have some of those skills. If somebody doesn't, I really try to do cognitive behavioral therapy because in there's a lot of education, but they're also starting to try some of the things that are going to be necessary to do acceptance commitment therapy. In fact, cognitive behavioral therapy, I think of more like a problem based intervention. And then acceptance and commitment therapy is they've already tried the problem solving and it's not working. Now it's how to accept and,
Yeah.
emotionally address. Yeah.
Fantastic.
Yeah.
I feel like optimists would be better suited to CBT and pessimists to break it down
That's
further.
that's an interesting way to look at it. I'll have to pay closer
Do a
attention.
study on that.
Yeah.
But it also links in, doesn't it? You must have heard of Mel Robbins and her concept around this idea of let them. Have you seen her
Oh,
behavior?
absolutely. I've heard
There
that. Yeah. Let
Yeah.
them.
So
Right.
I think that the let them kind of mentality definitely slots into that acceptance piece. Just let them get on and be them, and you just focus on being you. I think there's yeah. So I like that. I like that.
Well, the thing that I find is probably the biggest crux is this idea is that when people hear acceptance, they assume that you're telling
Yeah.
them they're gonna have to get over
Give
it
up. Yeah.
or give up,
Yeah.
right? And part of the hurdle is to explain to them that no, 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 that's not what we're saying. We're
Yeah.
saying is you're learning to live with what you have, but you're still going to have a fulfilling life if you're able to do that. If you continue to kind of focus on the disease itself, the thing that you're not able to control, you're going to continue to have the same difficulties. Yeah.
Yes.
Yeah.
Yeah. You're kind of setting them free from that fight, aren't you, in a way? You're saying, "Look, it's
Yes.
okay. Stop fighting this. Stop trying to get to the bottom of things
Mhm.
and undergoing, multiple surgical procedures." I'm sure you've seen patients like this. They are just unwilling to stop giving up in a way.
Right.
But actually, sometimes it takes someone like you who just comes along and goes, "It's okay. Let's just change our approach to this." And
Yeah.
that's still you fighting, but it's just you fighting to live a better life.
Life.
How
Exactly.
powerful.
Yeah,
Wonderful.
we use a lot of different, skills or different, experiences for them to kind of reach that conclusion themselves.
Yeah,
Because if I tell them, they're like, yeah, yeah, whatever. But
yeah.
if I get them there by doing different interventions, one intervention that comes to mind is I have them write every type of treatment they've tried to control their pain. And then I've asked them how effective that is, whether it's given them short
Wow.
term relief or long term relief.
Yep.
And that intervention, you really see people kind of the wheels start turning and they're like, "Oh my god, everything is short term." And you're like, "Yes. And what is it that you want?" And they want long term. And I'm like, Those two things will they'll never touch each other. They're like two parallel lines."
Yeah,
And so that intervention in and of itself will get people on a different path. I've seen them, right?
yeah, absolutely. And you have put pen to paper on this subject, David. You're the author
Mhm.
of the book Pain Relief Managing Chronic Pain Through Traditional, Holistic, and Eastern Practices.
Mhm.
Tell me about that. Tell me about these interventions which you found to be really effective and how they've transformed chronic pain and anxiety.
Absolutely. So, working in the hospital system that I work in, one of the things that I do on a weekly basis is I do something called the Pain Education School Program. And what it is we're teaching patients about 28 different treatments
Wow.
that are available for pain. We know about 4 or 5. If you ask any layperson, they know about 4 or 5.
Yes.
There's 28. And so what we do is we go through and we have the experts in each of those areas come in and they talk to the patients about, pain management from their perception. That's only available in the hospital system that I work. What about
Mm,
my patients who live in the civilian world?
yeah.
What do they do? That
Yeah.
does not exist. And so I would kept hearing this from people like, "You know so much, like, why don't you tell people?" And I'm like, "I can tell them, but I can only do it one person at a time. That's not fast enough." And so the creation of the book came from a need that I saw in the community where every time I would talk to somebody, I would start off with 3 things that they should start off with,
Yeah.
try.
Yeah.
And they would try those things and they would come back and say, "Oh my God, like, why nobody brought this up to me before?" And so it felt like there was a need in the in the community for that kind of, information.
Yeah.
And so the book is basically a reflection of what we teach in the closed hospital system versus what people talk about in the community, right?
I love that. So do you mind, without giving your total book away, just giving us some of those interventions that perhaps a layman might not necessarily have heard of, and
Yeah.
that's been found to be really effective?
Yeah. So there are, different sections of the book. There's traditional approaches, which are the ones that everybody is aware of, medications, injections, physical therapy. Those are the top three,
Yeah.
right?
Yeah.
And some people don't even know about those, to be honest with you. Some people have not been offered physical therapy or haven't been offered an injection. So it's an opportunity for them to maybe learn a little bit more about the traditional treatments. But then I go into the psychological treatments, biofeedback, hypnosis, cognitive behavioral therapy, acceptance and commitment therapy, mindfulness-based stress reduction that we talked about before. Um, and so, explaining to the common person about what that looks like when they walk in through the door and what to expect. Because if you take that kind of mystique away, they're more likely to try it, right? And then the third area is complementary and integrative health modalities. So things like acupuncture and meditation and yoga and tai chi and even some kind of herbs can be helpful when it
Yeah.
comes to chronic pain. And so going into those areas as well. And then the last area, I said three, this is four actually, is lifestyle factors. People do not realize how much their lifestyle is going to affect their pain. And so into things like physical activity and
Yes.
nutrition,
Yeah.
even sexual behavior is
Yes.
important to talk to patients about. And
Yeah.
so the book goes into all of that. Yeah.
Sleep, right? If someone's
Sleep,
knackered in the
absolutely.
day, they're
Right.
just yeah, absolutely. I love that.
If you're not getting
Fantastic.
your sleep, you're
Yeah,
not gonna get any restoration to your system, your mind and
absolutely.
your body, and so
Absolutely.
you're gonna feel dysregulated the next day, which then you're gonna feel it in terms of your anxiety or in terms of pain or depression, right?
Yeah, indeed. And David, your work has also looked at grief in patients with chronic pain.
Mhm.
So, how can the mind body interventions be tailored to help patients process those sort of emotional stages of grief?
So when it comes to grief, right? You look at Ross to look at the different stages. The thing that I think people lose sight of is that they're not linear.
Mm,
They happen, they change around. Um, I think the things that are important for people who are in grief, part of it is just to normalize that grief is an individual process,
mm,
and that there is no timeline to let them know that they need to get over it or be past that stage. I think the things that are helpful that are psychotherapeutic are things like social support is imperative when it
mm,
comes to grief, whether it be from family and friends or a support group that you become part of. It's talking about self-care, right? You're grieving, and what happens, you stop bathing, you stop eating, you stop socializing, you stop, right? And those things, again, as we just discussed, are really important when it comes to pain and even some of the mood disorders.
yeah.
And then finally, I would say the standard is cognitive behavioral therapy.
Mm,
So teaching people, different skills in terms of looking at their maladaptive thinking, but also their behaviors that might be perpetuating some of the feelings that they're having. But I think the most important thing for them to learn right away is this is individual. There's no right way or wrong way, and there's not uh, six steps that you have to go through. That those are all kind of come up at different times, and normalizing, the need to take time and process it in their way.
yeah.
But those type of interventions are important for them to know about,
Yeah.
and not necessarily be pushed into.
Yeah, indeed. And I often see, I don't know about you, but I often see delayed grief reactions when the patient then goes on later on in life to experience some sort of pain.
Mhm.
And it's almost like that gives them the green light to then grieve, but they don't recognize that the two are interlinked. And they'll sort of say,
Mhm.
oh, no, but doctor, that happened a couple of years ago. It's nothing to do with what I'm suffering with now. But it can often be not an excuse, but as I say, an outlet for patients
Yeah.
to express
To
their grief.
address,
Yeah,
right.
because they're in pain. Do you come across that? More
Oh,
of a delayed
absolutely.
reaction? Yeah.
Oh, yeah. Oh, yeah.
Yeah.
Absolutely. And, let's not, when I think about grief, when people hear the word grief, they're thinking about the loss of a loved one or a loss of a pet or, of a life form of some kind. what we kind of lose sight of is the individual that has chronic pain may be grieving the loss
Yes,
of social support, maybe grieving the loss of a job, maybe, right? And so there's losses that
absolutely.
maybe we're not being paying attention to because it's not a life form. It's another piece of this person's life that they're grieving the loss of. And so, it's making them aware of, I can't tell you how many people who reach retirement, they'll leave their job, they lose their identity, they don't know who they are other than the employment that they had before. And a lot of our work is grieving the loss of their job.
Mm,
Even though retirement's supposed to be the most happiest part of
yeah,
your life,
absolutely,
a lot of people take pride and they identify with what they work with. And so when that's taken away, they're lost,
absolutely,
right?
absolutely. And that's a wrap for part 2. Thanks for tuning in.